Hi, we have patients who have delivered vaginally normal delivery and then they have so many questions in the mind. So let's start the discussion today with our esteemed couple who has recently delivered. What was their experience in normal delivery? What are the frequently asked questions and how I can solve them and how it will help our patients?
So, for the audience, yes, my name is Radha Sharma. I'm 30 years old, and he is my husband, Prasanth Trivedi. We have come up with different questions, and I'm sure that all mothers or expecting mothers would have similar questions in their mind, but we forget to ask. So, let's hear from doctor what doctor has to say about it. So, doctor, I have listed down some questions. Like, as you know, I recently had a normal delivery with you, and the experience was very good. But I have so many questions in my mind running.
And you can go ahead.
Yes. So, doctor, now that I have had normal delivery, can you tell me what should I eat and what should I not?
Yeah, that's a very good question. After normal delivery, the idea is to have proper nutrition for mother and to have proper breast milk supply. So you must concentrate on healthy foods, that is nutritious diet. So you must include protein in the form of cow's milk or dals, vitamins in the form of fresh vegetables and fruits, adequate amount of water, fiber rich carbohydrates. So there is no need to have excessive amount of calories and no need to have lot of unwanted food items just because the tradition says so. Okay? We must concentrate on healthy food habits, avoid processed food and packaged foods, consume fresh fruits as far as possible, and avoid empty calories.
Thank you. Does consuming ajwain, various types of laddu, shira made up of ghee, sugar, or jaggery help after delivery? Does it increase the breast milk secretion?
So what happens? This ajwain, and that in Marathi it is called as ova. These food items they help in your digestion. Means if you're having indigestion problem, that will help you in certain extent. Okay.
Okay.
For indigestion, you can have food items also, or you can have vajrasan also. That will help reduce your indigestion. People keep giving these laddus like methi laddu, the shira, rava shira, dink laddu or gond laddu, and dates laddu. So these are given traditionally over so many years. The idea was as if they are going to cleanse your uterus or as if they are going to increase your breast milk. But there is no evidence which suggests so. Basically, these are very high calorie foods. And if you are not having exercises and all these things, you tend to put on weight, so it causes weight retention after delivery. So postpartum weight retention is a big problem. If you retain some amount of weight after delivery by eating such items, then that weight remain will with you forever. And then it may cause obesity related health problems like PCOS, diabetes, hypertension at an early age, joint problems in future. So better to avoid these unhealthy or these high calorie foods just because of the tradition says so. And prefer healthy foods. That is more important.
Thank you so much, doctor. Now I have some questions related to breast milk as
Yeah.
I'm a new mom. So, what is this breast milk made up of?
See, the breast milk consists mainly of water. 88% is water content. 7% is lactose, that is carbohydrate. 4% is protein, and 1% is fat. So from this you can make out that the major chunk of breast milk is made up of water. So it is important for you to remain adequately hydrated so that you have adequate milk supply and have nutritious foods. Milk contains adequate amount of nutrition.
Thank you so much. But, doctor, sometimes I feel my breast milk is less in amount. How can I increase my breast milk?
So this is very good question. Many moms have this problem. So basically breast milk in initial phase is called as colostrum. It is a very thick material and it is quite nutritious. It gives lot of antibodies or immunity. So don't go by quantity of milk. Look at the quality of milk. Colostrum is full of antibodies. Means whatever illnesses you have had that has produced antibodies in your body and that you are transferring to your baby via breast milk. So even it is so thick in consistency that small amount of colostrum is also enough to fulfill for the demands of your baby. There is a trend to go for only exclusive breast milk But in cases of summer or if the baby is hungry still, you can add top feeds for initial few days, but by the end of 4 days, adequate milk breast supply is established, then you need not give any top feed as such.
Okay.
How to increase breast milk? Okay, so now the thing is that breast milk secretion is more governed or dictated by mind than by body and then by diet. Okay, so if you have positive mind and if you have positive attitude and if your environment is positive and supportive, then naturally will secrete more breast milk. The very thought that my baby needs my milk, that itself is enough to produce adequate amount of milk. And there is something called as sucking reflex. So when the baby sucks at breast, the stimulus goes from your breast to your brain, and that causes releases some happy hormones that causes breast secretion that also helps in letting down the milk. So the milk is laid down in the breast and the milk flow starts. So all this is more of psychology. Then second comes is health, and last is diet. Then there are traditionally certain items which are thought that they will increase breast milk supply. Means fenugreek, that is methi, fennel, certain herbs, shatavari. All these things are thought to increase the breast milk supply. You can have cow's milk.
Thank you so much. Doctor, sometimes I feel my breasts have become hard, that is, they have engroved. What to do for that? How about using artificial nipple or breast pump when I face those kind of problems?
Okay, so when the breast becomes full with breast milk, this sensation comes that is called as breast engorgement. The breasts become hard, they may be painful, and they may be sore. So it's a matter of demand and supply. By any means, baby is suppose not well and not sucking properly, and suppose you are giving the baby top milk, then also there will be lot of congestion of milk in your breast, and that also can cause you engorgement of breast. So the simple is feed the baby more frequently. Avoid outside milk so that the baby gets your milk only. So you will empty your breast. They will not feel engorged. If you feel that after feeding the baby and after the baby becomes satisfied, still if there is more amount of supply or more amount of breast milk congestion, then you can just gently express it out by your own hands. You can use some warm water, warm compress massage on your breast so that you will feel better. And if this problem still persists, you should see your doctor, you should see me so that I can guide you. If there's some medications are required, we can give you so that it will not progress to breast infection, that is mastitis, and it should not end up with breast abscess, that is pus collection. So timely handling this situation, handling these problems is very important. Also, uh, the one can use breast pump, to express breast milk, but it should be done in such a way that the milk remains sterile. It should not get, dirt or infection or germs from the breast milk. So if you want to use that breast milk to feed, that should be collected in a proper sterile way and to be fed to the baby via preferably vati spoon, which is boiled. So that plastic materials we don't recommend because that can cause some infection or diarrhea to the baby. So prefer stainless steel boiled vati spoon material. If one has say flat nipple or retracted nipple, then one can use artificial nipple shield which are available outside. You just have to clean it with warm water so that they become sterile, and then that artificial nipple shield has to be applied on the breast, and through that one can breastfeed the child. So it acts as if your own nipple, and the baby gets the milk.
Thank you so much. So, doctor, now coming to the exercises. When can I start doing exercises after normal delivery? Which exercises do you recommend?
So once you have a normal delivery, the things are quite easy. You can start walking about immediately after normal delivery. And you can start light household work and routine exercises as and when you feel comfortable to do so. And also I will recommend you people to do pelvic exercises, or what we can call as Ashwini Mudra in Ayurveda, or also we call it as Kegel's exercises in English. So you at the time of delivery, what happens? Your pelvic floor muscles and your area of delivery, all those muscles become loose. Perineal muscles become loose on legs. You may have stitches at the perineal area. So to overcome this looseness of the muscles and to regain strength of this pelvic floor muscles, you have to do what is called as Ashwini Mudra. So as if you are traveling and holding your urinal stool for some other reason, The same way you contract your pelvic floor muscles and your perineal muscles, so that you contract, hold for some time and relax. So the muscles will regain their strength. Okay. So these things you can start. These pelvic exercises don't need any timing. You can do it anytime. You can do 100 times a day also. Afterwards, gradually, after few days, you can start doing floor exercises. As you rightly said, you used to do yogasana. So you
Yes.
can resume yogasana after a few days. You can start pranayam immediately, and asanas you can do after a few days, maybe second week or so, once you are comfortable. Selected asanas as per your knowledge, or you can consult your yoga trainer. You can ask me which asanas to perform. So those asanas in pranayam you can start in first and second week of after delivery. Okay. Then then comes other exercises, like suppose you are doing aerobics or cycling or swimming. That maybe we can keep it for later period, maybe third or fourth week after you have delivered. As and when you feel fully fit, you can do these outdoor exercises. But indoor exercises and routine household activities you can start as early as possible. So as I told you about the pelvic floor, what happens to the abdomen, in the when the uterus grows, it grows in three directions. So anteriorly, sideways, and upwards. So the rectus muscles go on to a one side. It's called a sort of divarication of recti. Rectus muscles go on the sides. So you should do core exercises so that your muscles, regain strength and they come in the midline. Okay, so these are called as abdominal exercises or core exercises. These after normal delivery you can start even on second, third day or fourth day also. If one patient has undergone cesarean, I will recommend not to do core exercise for 42 days, because it will add to your abdomen where the scar is there and where the wound is there. So for cesarean after 42 days, but for normal delivery as early as first end of first week or second week, you can start doing your core exercise so that your abdominal muscles regain your strength and your abdomen doesn't look loose or lax. Right.
Got it. Thank you so much. It helps. Doctor, I don't want to retain too much weight after normal delivery. How can I achieve this?
So that's what I told you initially. You should concentrate on healthy foods and not consume high calorie foods. Have nutritious diet, and you should not lie down for 42 days. Many people in old timers or traditionally they used to say, don't move for 42 days, you just lie down. So this is not necessary. So be active, start moving about, do your exercises in your daily routine, and keep a weight check. Every week you should weigh yourself and check, so that your target at the end of 42 days, which is your purpurium. So end of 42 days, try and achieve your weight, which was your weight before you started with your pregnancy. So if you have proper diet and proper exercise in proper daily routine activities, it is very easy to come back to your pre-pregnancy weight. Suppose you started your pregnancy with 60 kg weight, and at the end of delivery you were 72 kg, and after delivery, after 42 days you should come back to 60 kg. Whatever is more after 42 days, that is called as postpartum weight retention. So healthy food, healthy diet, and routine exercises you can achieve this pre-pregnancy weight at the end of 42 days.
Okay.
That should be your aim.
It's tough. We'll try.
Yes, yes, yes. You can do it. I'm sure you can do it.
Yes. Okay. Can I lift some objects with some weight, and how much weight? Because it is said we should not lift the weight. So how much weight I can lift?
You can lift as much as 5 kg weight very easily. So your baby itself is weighing 3 kg. If any other article in the house we have to lift, it should be preferably less than 5 kg weight.
Okay.
Okay, so that is comfortable as far as weightlifting is concerned. While bending, taking something from ground, you should bend from knees and don't bend from back. Otherwise, that will give you backache. Lifting weight from ground, bend from knees, and then lift the weight. After 42 days, you can have lift little more weight also if the need arises. But light activities, yes, you can start as early as possible. Once you are comfortable, you can start your household work and routine activities.